If you're someone who enjoys a daily shower, a quiet, familiar ritual that starts or ends your day, I want you to listen closely for the next few minutes. I'm Dr. Thomas, a cardiac surgeon who has spent more than 25 years caring for older adults, and I have seen a pattern so consistent it stopped being coincidence and became a warning. There are ordinary choices we make in the bathroom: the temperature of the water, how long we stand when we shower, how we react to a slip or a sudden chill. That, repeated day after day, can quietly strain an aging heart. I don't say this to scare you, port. I say it because knowledge gives you the power to change small things that can protect your heart for years to come. If you haven't already, port. Please subscribe and tap the bell so you don't miss future tips like this. If this video helps you, type 1 in the comments. If it doesn't, type 0 and tell me how I can improve. Now let me take you through what I've learned in plain terms from operating rooms and clinic visits across the country. What happens inside the body during ordinary shower routines, why older hearts respond differently, and exactly what to do instead to keep your heart strong. Think about hot water first. For many people, a steaming shower is the closest thing to comfort after a long day. But as we get older, our blood vessels lose elasticity. They don't dilate and constrict as quickly as they used to. When very hot water hits the skin, port, blood vessels widen suddenly, and a lot of blood pools in the skin and extremities. That means less blood returns to the heart, and less blood goes to vital organs, including the brain. The immediate response, especially in an older person, is a rapid fall in blood pressure, followed by a compensatory increase in heart rate. That racing heart, that brief dizziness or lightheadedness, may feel like a normal side effect of warmth, but repeated episodes create stress. Over months and years, they can weaken the heart muscle, irritate the electrical system that keeps the rhythm steady, and make someone more prone to arrhythmias. For a person with high blood pressure, blocked coronary arteries, port, or heart failure, that momentary drop in pressure and surge in heart rate can be dangerous. If your bathroom fills with steam and the oxygen content of the air drops even slightly, the heart is forced to work harder in an environment that feels soothing but is actually taxing. The practical steps are simple. Reduce the maximum temperature in your water heater so the water never becomes extreme. Test the water before you step in, and favor warm over scalding. You can still enjoy a comfortable shower. Just make the temperature a friend of your heart rather than an adversary. Now consider the other end of the spectrum: cold shock. Some people praise cold showers for invigoration or circulation, and younger bodies often tolerate it without issue. But for someone over 60, port, a sudden blast of cold water is not a healthy wake-up call. It's a reflex that tightens blood vessels immediately, sending blood pressure up in seconds. Port. The heart meets that sudden resistance by pounding harder, and in a heart with stiff arteries or fragile electrical wiring, that pounding can trigger dangerous arrhythmias, chest tightness, or even reduce blood flow through narrowed coronary arteries. People with heart failure may find their symptoms worse after abrupt cold exposure because the circulation changes can increase fluid congestion. The safer approach is gradual. If you like contrasts, move slowly between temperatures, or better yet, avoid sudden cold altogether. For older adults, brisk cool water for a quick splash is one thing. Prolonged exposure or sudden extremes are another. Protecting the heart means moderating the shock to the system. Length of time in the shower matters too. Standing in one position for a long period, especially in a steamy, warm shower, causes blood to pool in the legs. Veins become less efficient at returning blood to the heart, port, and the heart compensates by increasing rate and force. Combine that with mild dehydration that can happen in a humid bathroom, and the result is a lower circulating blood volume with a heart that needs to work harder to maintain blood pressure and organ perfusion. Older veins and weakened muscle pump in the legs make this worse. Many of the fainting episodes and near falls we see in hospitals start this way. A long shower followed by dizziness when someone steps out or bends over. Keep your showers at a comfortable length. If you love long, leisurely showers, port. Try sitting for part of the time, alternate warm and cool periods slowly, and make sure you drink water during the day so you're not starting the shower already slightly dehydrated. Small changes in posture, gently moving your legs and flexing your feet while standing, can improve venous return. And if you feel lightheaded, sit down immediately rather than pushing through. Timing is another surprising factor. The body's circulatory system changes rhythmically throughout the day. First thing in the morning, blood pressure and heart rate are often still low after sleep. standing quickly, or stepping into a hot or cold shower immediately after getting out of bed forces a sudden shift in blood distribution and can cause dizziness or a dangerous drop in blood pressure. Right after eating is another vulnerable time. Digestion demands a greater share of cardiac output, diverting blood to the gut. If you step into a hot shower during that period, blood vessels dilate and blood pressure can fall further, creating a perfect storm for fainting or cardiac strain. The practical advice here is straightforward. Give your body time to wake up after rising and allow at least 30 to 60 minutes after eating before you take a shower. If you must bathe sooner, keep the water temperature moderate and avoid prolonged standing. Safety underfoot may not sound like a hard issue, but it very much is. A wet, slippery bathroom floor increases the likelihood of falls and sudden shocks. When a person slips, the body releases a surge of stress hormones, adrenaline and noradrenaline flood the bloodstream, blood pressure spikes, heart rate accelerates, and the heart can go into an abnormal rhythm. For someone with coronary artery disease, that sudden surge can precipitate chest pain or worse. Even a near fall, with panic and a racing heartbeat, can destabilize a fragile cardiovascular system. Good bathroom safety reduces not only mechanical injury, but also cardiovascular risk. Use non-slip mats secured with adhesive or suction. Install grab bars at the entry and near the shower bench. Ensure adequate lighting, port. And keep frequently used items within easy reach so you don't have to stretch or balance precariously. If you use a shower chair, make sure it's sturdy and properly positioned. After a fall, even if you feel fine, get medical attention if you experience chest pain, shortness of breath, lightheadedness, or palpitations. These can be delayed signs of significant cardiac stress. All of these habits interact. A hot, long shower right after a heavy meal in a poorly ventilated bathroom, port, followed by a sudden slip, is not a random chain of events. It's a predictable pattern that multiplies stress on the heart. Our bodies are resilient, but resilience declines with age. The heart that carried you through decades of life becomes less able to absorb repeated, avoidable insults. The good news is that you can rewrite that story with a few mindful adjustments that are easy to implement. Start with your water heater. Set a safe maximum temperature. Many experts recommend around 120 degrees Celsius 49 degrees Celsius as a maximum for households, but for older adults you may choose an even milder upper limit to avoid scalds and extreme vasodilation. Get into the habit of testing the water with your hand or wrist before stepping in. Favor warm, not scalding, and avoid sudden extremes in either direction. Port. If you enjoy contrast showers, make the changes gradual. Take a few deep breaths and let your body adjust over several seconds rather than slamming the faucet from warm to cold. Next, think about timing and routine. If you wake up feeling dizzy or unsteady, sit on the side of the bed for a moment, take a few slow breaths, stand slowly, and delay the shower until you feel steady. After eating, wait a while before bathing. Try to schedule showers during times when you feel alert and hydrated. Keep the shower duration reasonable. Most people can get clean and comfortable in 5 to 10 minutes if they are intentional about it. And if you want longer relaxation, consider a warm bath done safely with assistance or a chair. Improve your bathroom environment. Install grab bars, use non-slip mats, add a shower chair if balance is an issue, and ensure good ventilation to avoid excessive steam buildup. A small fan or an open window reduces humidity and keeps oxygen levels more comfortable. Ground your routines with safety. Leave a light on overnight, keep a phone or medical alert device within reach, and use a thermometer if you have sensory deficits and can't accurately judge water warmth. Pay attention to how your body responds. If you notice repeated episodes of lightheadedness, palpitations, breathlessness, or chest discomfort associated with bathing, bring it up with your provider. These symptoms are signals, not annoyances to be ignored. If you have known heart disease, arrhythmias, uncontrolled hypertension, or heart failure, take extra precautions and discuss your shower habits with your cardiologist. Sometimes small medication adjustments or extra fluid management can reduce risk. If you're on medications that affect blood pressure, like diuretics or vasodilators, timing of those medicines and timing of showers may deserve special attention. There are also simple habits you can practice right now. Drink water through the day so you are not starting a shower slightly dehydrated. Move your legs gently while you stand to help venous return. Sit on a shower chair if you become tired. Keep your phone or a call button nearby. Have warm, steady lighting so you don't misjudge footing as you step in or out. Use a handheld shower head so you can control water direction and intensity more easily and avoid sudden sprays to the face or chest that might trigger reflexes. Let me share a couple of stories from my years in practice, because real examples often make the risk clearer. I treated a woman in her late 70s who loved very hot showers every night. Over months, she developed episodes of dizziness and near fainting that she attributed to just getting older. One evening, she actually lost consciousness in the shower and was found by her daughter. She survived, but the investigation showed repeated episodes of low blood pressure and stress on the heart likely related to her bathing routine. After lowering her water temperature, shortening her shower time, and addressing mild dehydration with more daytime fluids, her symptoms largely resolved. Another patient, a man in his 60s with coronary disease, developed severe chest discomfort after stepping into an icy water spray briefly after lunch. It turned out the abrupt cold exposure had caused a dangerous surge in blood pressure and strain on his heart. We changed his habits and adjusted medications, and he avoided further episodes. These are not dramatic, rare cases. They are everyday scenarios with everyday solutions. I know change can feel small and inconsequential. A habit that has comforted you for years doesn't seem like a threat, but when we add up repeated daily stresses, they become meaningful. Protecting the heart doesn't require heroic measures or giving up pleasure. It requires thoughtful adjustments, gentler temperatures, timed routines, safer floors, shorter standing, and a little attention to hydration and posture. Those changes can preserve the heart's resilience and reduce the risk of fainting, arrhythmia, injury from falls, and long-term weakening of heart function. If you care for an older family member, take a look at their bathroom routine. Watch how they enter the shower, how long they stand, what temperature they prefer, and whether they ever complain about dizziness afterward. Offer to help install grab bars, get non-slip mats, or set the water heater to a safer maximum. And if you're an older adult watching this for yourself, test one small change this week, lower the water temperature by a notch, or sit for part of the shower, or wait a half hour after eating before bathing. Notice how you feel. If you have symptoms, bring them up with your doctor. These small experiments are low risk and high return. Before I close, remember that the bathroom should be a place of comfort and dignity, not a hidden hazard. By making a few deliberate changes, you can keep it that way for decades. If you learned something useful today, type 1 in the comments and tell me which change you'll try first. If you want more guidance, checklists, suggested grab bar placement, or tips for people with limited mobility, tell me what you need and I'll make a follow-up video. If you didn't find this helpful, type 0 and tell me how I can do better. And please share this with someone you love. These are practical steps that can prevent a serious medical event. Thank you for spending this time with me. Take care of your heart, take care of yourselves, and remember that simple, mindful habits can make a life-saving difference.